there are two major types of diabetes. There's what's called type 1 diabetes, which used to be called juvenile diabetes, and type 2 diabetes, which used to be called adult onset diabetes. The reason why we don't use the term juvenile or adult anymore is because there are adults who can get the juvenile type and there are juveniles who can get the adult type. So now we refer to it as type 1 and type 2. Type 2 is a much more common form of diabetes, tends to run in families, much more related to weight. So as one gains weight, you're more prone to developing type 2 diabetes. Type 1 diabetes is indeed more typically seen in younger people, but it's not weight related. And the problem in type 1 diabetes is that it's an autoimmune disorder in which the immune system has just destroyed the function of the pancreas in terms of making insulin. And as a result, people with type 1 diabetes really require insulin to keep their blood sugars under control. People with type 2 diabetes, the main problem is really related to weight and this problem we call insulin resistance, but they can respond to a whole host of oral agents, pills that we use, in addition to insulin if it's needed. The big problem with diabetes is that it's an epidemic, both in the United States as well as across the world. As people keep gaining more weight in general, we're seeing more and more diabetes. Diabetes is an important disorder to treat because without treatment, it leads to what we call long-term complications. That includes eye disease, kidney disease, vascular disease, nerve damage in the legs. So unfortunately, the leading cause of blindness in the United States is diabetes. There are also a number of people who are pre-diabetic, where they don't have full-blown diabetes, but they're on the road. And these are also people who are tending to gain weight. We will see that they tend to have high blood pressure, that they've gained most of the weight in their abdomen, that they have high triglycerides, low levels of HDL, which is the good cholesterol, and eventually we'll see that their fasting blood sugars start to rise. And we know that over time, these people will develop diabetes unless we can do something to slow that down. And the best way of slowing it down is through weight loss. And the best kind of diet to lose weight in this setting is to be on a low carbohydrate diet.